Welcome back. I'm Maggie, the host of Neighbors Helping Neighbors, the podcast from Father Joe's Villages. This is a series where we explore homelessness, its causes, and solutions to the issue. Our guests include experts and leaders in this space, people with lived experience and unique perspectives on homelessness. Father Joe's has been a beacon of hope for 75 years, and if you'd like to learn more about our mission, visit us at neighbor.org and follow us on social media at Father Joe's Villages. Today we're talking about behavioral health, what it is, the barriers faced by our neighbors in need, and how the community is fighting back, showing compassion and addressing these complex issues. Join me in welcoming our distinguished guests, Dr. Carla Marienfeld, addiction and psychiatry expert from UCSD, and Councilmember Raul Campillo from District 7. With me always is my co-host, Deacon Jim, President and CEO of Father Joe's Villages, to explore this topic. Welcome. Thank you for being here.
Thank you.
Oh, it's great to be together. Absolutely. Welcome. Thank you.
Thank you.
Thank you.
Let's start by taking a minute to introduce yourself and telling a little bit about the scope of your work.
Excellent. Well, I'm Raul Campillo. I represent San Diego City Council District 7, and I'm the chair of the Economic Development and Intergovernmental Relations Committee. Very long name, lots of things underneath it, but one of the things that falls underneath it is our relationship for the city of San Diego to other governments, the state government, the county government, federal government, and we know that Health and Human Services has traditionally been a county and state government issue, and the city typically has land use and policing powers and other things like that. I've been using that office to focus on how we can help mental health issues be solved quicker in a city that really hasn't focused too much on it. So being the chair of that committee has been an honor, and transitioning its efforts towards helping people who are suffering from mental health issues.
Wonderful. Thank you.
And yeah, I find you're the right person for that position, by the way, so I'm glad you're on it.
Well,
That's
thank
great.
you. I wanted to be that chair, and this is my fourth year being it, so yeah.
Wonderful.
Wonderful. I'm very honored to be on this committee. My name is Carla Marienfeld. I'm a clinical professor of psychiatry, and so my background is as a psychiatrist in helping to care for people with general mental health problems. And then I also did fellowship training in addiction psychiatry, and I also did specialization in addiction medicine, which are related areas. And so that gives me a unique focus on the overlap of both addiction and substance use problems that people have, as well as the often co-occurring mental health problems that they have. I also run a small clinic, an outpatient clinic that treats people with substance use disorders and co-occurring psychiatric disorders. I run our addiction psychiatry clinical fellowship training program, and I'm also involved in several research projects looking at helping people with substance use disorders.
Wow. Wonderful.
And that's why we were excited to have you with us, by the way. Wait until we delve into it. That's what we're all about.
I think I'm aware of a lot of the problem, and it's great sort of thinking about the ways I might go about treating it from a medical perspective, as well as how the city and other organizations, community partner organizations, can all work together to really tackle it from all angles.
Right.
These are the three people to have at the table. This is perfect. Go ahead.
Well, and I'm, as Maggie said, I'm the co-host, and I'm also the president and CEO of Father Joe's Villages. Let me just give you a little bit of background about what we do and what we're about. 75 years, Maggie mentioned, and we have a federally qualified health center. One of our pillars we have 4 pillars within our organization. That's one of the key pillars, because we know there's an intersection of health and homelessness, or poor health and homelessness, and housing as well. And so being able to really meet people where they are and help them not only in with their primary care, but especially with their behavioral health issues that they have. On the mental health side, on the substance use side, it's absolutely critical. And frankly, I believe that at this point in time, unless we are laser focused on that in our community, we really won't be able to get our arms around this homelessness situation. 40% of those who are on the streets, who are homeless, have some level of mental health challenges. Some have them when it throws them onto the streets. Some develop it because they've been chronically on the street. And then similarly on the substance use side, we have about 40% also who suffer from substance use and the combination of the two sometimes. And so anyway, that's very great key. We're going to get into that aspect of it. That's what this segment is all about. But in addition to that, we have a dental clinic within our federally qualified health center. Again, if you were to visit us and you was to visualize the wall of smiles that we have, the before and after restorative dentistry, they just tell the message, right? Who's going to get that job? Who's going to get that apartment, right? And so that's our FQAC. But in addition to that, we help our children. We have children literally from when they are born up to 18 years of age. We have a preschool program, and we have after-school programs for school-age kids as well, mentoring and tutoring and the like. And we know that the kids who come to us because they are academically, emotionally, and socially delayed, if we don't mitigate those circumstances, they're 4 times more apt to be homeless as adults. Right, so that's very key. So we must break that cycle. We don't want them to be the future adults who are homeless. We have our shelter system, almost 1,000 beds that we offer at Father Joe's Villages, various locations. And they also have diversity in the shelter because we have some that are sober living, we have some for families, we have some that are low barrier because we know to expect sobriety of everyone is unrealistic. And if we don't take them in and help them, we're relegating them to the streets and to death. We know that in the past year, over 600 people have died on the streets, 375 of whom have died of drug overdoses. The Councilmember and I've talked about this a lot, right? So we know we have to meet them where they are and provide detox, we'll talk about that, provide recovery beds as well. So there's low barrier, but there's also recovery and sober living that's necessary as well. There can't be a one-size-fits-all. And that's what we're all about, not having a one-size-fits-all, making sure we tailor our programs and our resources to the needs of the individual, because everyone has its own circumstances. And then so that we can be most effective and most sufficient with those precious dollars that we have, whether they're public dollars or private dollars. And then we have Turning the Key. That's our initiative to develop housing. Yeah. At the end of the day, that's what breaks the cycle of homelessness, is a house, right? And the council member especially knows St. Teresa of Calcutta Villa, that 14 stories, 407 homes. That we opened 2 years ago, over 500 people who have either been taken off the streets or have been kept from falling onto the streets. Yeah. That's what breaks the cycle of homelessness. But not just a home, but the comprehensive services, those wraparound services, which help them to retain their homes and prosper. And so that's kind of a whirlwind of what we're all about. Of course, there are a million meals we serve on a yearly basis. I mean, I can go on and on.
Just a million.
But I'm excited because today's segment has to do with behavioral health. And as I mentioned, we must be laser focused on this as a community in order to truly work through this issue that we have in San Diego that we call homelessness, right? So with that.
Well, let's start with what is behavioral health and how does it intersect with homelessness?
Well, there's a lot of ways of looking at how you think about whether somebody is healthy from a behavioral standpoint, right? So we can talk about mental health. Are there things that are going on in your life that allow for you to be able to live and be meaningfully participate in your life? And sometimes we think about wellness as well. As a psychiatrist, we also look at some of the diseases and disorders that people can have that can impact their mental health. So sometimes there's stressful situations, there's all of the different issues around housing and poverty and trauma experiences and other huge stressors that people go through that affect their mental health. And for some populations, there's additional challenges trying to manage all of that because they have an underlying depression that makes it that much harder, or an underlying bipolar disorder, or a significant anxiety disorder. Sometimes people's trauma experiences lead to PTSD, which is the post-traumatic stress disorder that some people can have as a response to these significant traumas that they have, and that would be characterized by its own symptoms and impairments in functioning. In addition, there are psychotic spectrum disorders where people really have trouble organizing their thoughts sometimes, and their thoughts can be really disorganized. They can also have symptoms of delusions where they think things are true that other people would not agree, and they strongly believe that these things are true. They can sometimes hear or see things that aren't there as well. And so there's a whole spectrum of ways in which things that we think of the brain as controlling can impact us to where we would have something to the level of a disease where it impacts our functioning so much that it makes it that much harder. And so when you have that going into the other stresses that make somebody prone to homelessness, it's that much harder, and it can be that much harder to come out of. And I think what you said earlier in your introduction was really helpful, that bi-directional relationship. Sometimes there are all these things that happen that lead somebody into being unhoused, but also the stress of being unhoused, also, or the traumas that you might be exposed to, or the life of living in that way can also influence development of these problems as well. And so then it's that much harder. And so if you don't think about them together in that bi-directional way, it's hard to make progress on them.
Sometimes that's how they self-medicate. As in, they self-medicate, I should say, in order to deal with their circumstances, as an example. Yeah.
I don't love the term self-medicate because I don't always think of these behaviors sometimes as being adaptive. I think that sometimes people don't always have the skills, or they haven't learned other ways to try to manage or have the other supports they need to manage these things. And so I definitely understand that idea of trying to self-treat and trying to do something to change how you're feeling or what you're experiencing. But I don't know that misusing substances is really best thought of as a medication.
Right.
But it's definitely an attempt at trying to cope or manage with these difficult situations.
Can you say more about what impact homelessness could have on somebody's behavioral health? And for those who are housed, the impact that mental health or substance use disorders can have on maintaining housing, stable housing?
Well, it's a complicated relationship, and I think there's a really important movement towards housing first. Really meeting those basic needs that people have can kind of provide that very basic foundation that they might need in order to then begin to address and manage some of the other things that they're dealing with. There have been some studies that have shown that housing first can be really helpful, and then there have been some other studies that have sort of mixed outcomes with it. And I think that speaks to the complexity and how interrelated these things are. And so I think that, in a simple way, I think of it as really trying to target at the same time these basic foundational things that are so important for living. You need food, you need a safe space to be, you need shelter from the environment around you. But just focusing on that, or just trying to address the depression, or just trying to address the psychosis without meeting the basic needs, neither of those alone are sufficient, is how I understand that.
Absolutely. That's true.
What are you seeing in the community, Deacon and Councilmember? What are you seeing in your communities in terms of folks suffering from behavioral health issues?
Well, what I certainly see is that it's people who are housed and unhoused who are suffering from mental health issues. I think that it's important to understand the stress of the cost of living in the San Diego region really saps a lot of that positivity that naturally exists in a community. And a lot of young people, a lot of older people are saying this is not tenable for much longer. So if you already have a hard life, imagine it being just a little bit harder. And it's, stress is not linear, it's exponential. A little bit more weighs a lot heavier on your shoulders than the previous pound of stress. So I'm seeing a lot of people who are housed saying, I might not be housed next year. So they have to make economic decisions of, what is it called? Rationing. It's like, am I gonna pay for electricity? Am I gonna pay for my prescription? Am I gonna pay for rent? Am I gonna let the mold that's in my bedroom, am I gonna pay to fix that? It's like, well, that's immediate health needs. So you have a lot of people who are making what is a rational decision right in front of them with not a lot of good options. And that is what a lot of housed people are facing that then become housed, especially as we see seniors principally growing and growing as a percentage of the unsheltered population, because the cost of living for them might be fixed, but their prices are going up. Now, I think that is what that tells me is how do we put money in their pockets so that they can afford and make choices, which is freedom for them and reduces stress, and how do we give them options? Because it's not just about having money. One of the things about having housing is there's not a lot of options, so there's still a lot of stress. We need to provide people with options for housing so that they can say, I have what's best for me. I think the thing the deacon pointed out about all the services that Father Joe's provides is we have options. If you suffer from this particular problem in your life, we have an option for that. And that creates less stress. That is worth its weight in gold, quite frankly. And so I'm seeing those things not just in homeless individuals, but in housed individuals as well.
Yeah, it's interesting, that point. It's an excellent point you surface, Councilmember. The stress, I see the stress being felt by the young people. The young people who are getting out of college, as an example, not being able to find that first apartment. It used to be, I'm a baby boomer, by the way, so when you talk about seniors, I can relate, right? And I'm blessed in many ways, but there are people who are boomers, or the baby boomers, who are falling onto the streets, especially in a market like ours, because it's so expensive to live here. But I'm also seeing at the other end, these kids coming out of college, and they think, used to be, if you got a college education, hey, you're set, right? You're gonna get a job, you're gonna find an apartment, and you're going the American dream, in a sense, and it's harder. It's become harder and harder to recognize and realize that American dream, and I see that stress also at the opposite end for these kids, right? And as a result, it throws them off track, is what it does, right? And they have their own host of issues that then they with which they contend as well.
It's interesting. It reminds me of conversations when we talk about depression. Sometimes we talk about this foreshortened sense of the future. This sense that when you're depressed, it's harder for you to think ahead, to think that there could be good things or that there's good experiences. And I think we hear about that a lot as well in people who are struggling with really huge acute stressors. It's hard to see that there could be better things in the future. And then, like what you said, this young generation in particular doesn't have that guarantee of the American dream, that they have faith in that they're going to be okay. And so again, you have this sort of foreshortened sense of being able to look forward and kind of use that to keep moving down a path when it gets tough or difficult, because you have some sense that there's something good at the end. And so I think bringing it back to that combination of behavioral health and the stressors that unhoused people have, it's that combination of, well, your situation is making it harder for you to see that. Then if you have this co-occurring depression, that makes it harder to see that. And then you sort of have all of these stressful circumstances that you don't have options to think about, what can I do? They're really, you can't see that there are options. That, I think, also is a really difficult place where people can feel sort of paralyzed. And I like what you said earlier about all the different levels of care, because not only do you need different levels of care, but you need different options within those levels, because each person is unique. And if I can bring it back to one more thing you said, meeting people where they're at is really critical, because if you don't see people for their unique situation and try to address the things that are pertinent for them to succeed, then it's going to be really hard for a lot of people to rise up, because a one-size solution is only going to help a certain small portion of the population. And
when you help that small portion of the population, it can affect the whole as well, and that's what we find as well, right? So to get great segue to a conversation I had with the council member, you'll recall, tail end of last year, may have been December or so, because I meet with the council members individually, periodically, right? Just so that they know what we're up to, and I like to know what their concerns are as it relates to homelessness. So I had that meeting with the council member, and I told him something had been weighing on my heart for at least a couple of years, right? You'll recall, and that was that it's just, more and more people are dying on the streets. I made reference to it before, right? And because of substances, because of overdoses, fentanyl is wreaking havoc. Xylazine now as well, right? So, and we need to help. There can be hope. There's always hope if we help the person stay alive. Then there's always hope, right? And so I said to him that we were interested in starting Detox, focusing in on Detox, because there aren't enough beds here. In the city of San Diego, 2 beds. Right? In the entire county, including those 2 beds, is 78 beds. nowhere near what we need. And those beds don't go to the population we serve. And so it had been weighing on me. I said, I really want us to focus. I want to repurpose some beds. But he took it to heart. And 3 months later, I hear from him and I said, by the way, remember that conversation you had with me? I've been putting together some legislation, and it led from there to you presenting it at the City Council in early July and getting that passed. And that's going to help tremendously in being able to stand up behavioral health clinics that can focus on detox, can focus on mental health challenges. And I just can't thank you enough for that.
Well, you bring up the legislation in July. I think back to the town halls that I had in my community, because I always do 4 town halls in January, February with the different neighborhoods in my district. And I brought up that number that you taught me and taught my constituents. There's only 2 Medi-Cal eligible, but there's only 75 to 78 beds in the entire county, and that blew their mind. But when you seeing my community members saying, "Oh, that needs to be fixed," just gives me back the sense of urgency that my constituents want to see it done too. So you taught me. I went and preached it out, and they said, "Oh yeah, that's something we want to see you tackle." So it's actually full circle, and that's how government should work. Learn from the experts, go communicate with the community back, take their feedback and desires, and actually put pen to paper and make a law on it. So it's the way it's supposed to happen.
And isn't it beautiful when it does? By
Yeah.
the way? Yeah. And it's going to be even beautiful when this is up and running come in the beginning of next year. We can't wait, right? It's going to be a game changer for those who are going to go through the program. And as I mentioned, you help that population, and who gets healthier? The entire community, right? I mean, it's a no-brainer, right? And so we're excited as can be about that.
I was going to say, there's one other thing, right? We're talking about seniors, we're talking about youth. I think just middle-aged families that also have that stress.
Everybody.
I think, and here's the social repercussions of that lack of choice. As more and more people in the public realize that it's harder and harder to achieve the thing you thought your children could or that you could for them, it starts to fall by the wayside. Taking a risk and in starting a new business, charitable giving, volunteer hours in your community, because you're thinking, I don't have time to spare. I got to take care of my family because the risks out there are bigger than they used to be. And what we start to see is the social fabric starting to tear. And so if we take care of our most vulnerable in the way that Father Joe's is doing, and with the resources that they've been asking for us, that the public has been asking for us, that sense of we're accomplishing things starts to alleviate in the community, and people start to feel more comfortable in their own settings with their own families and start to do the things that create a positive community, like being a volunteer, like giving to charity, like helping out philanthropy. So there's reverberating economic repercussions by not helping the most vulnerable. And why not help the most vulnerable who are suffering? And then we start to see over the course of 10 to 20 years, actually that boosted a whole bunch of other social indicators. It's one of the best things about helping those who need it the most.
I agree. In fact, we've been hearing in the last 2 years, every single month, nonstop actually for the last 2 years, that there are more people who are falling into homelessness that are being helped out of homelessness. We hear that on the news month in and month out. It was, I think, September of last year. I turned to my team and I said, you know what? The public is becoming so disheartened. I could tell by the types of questions I was receiving from the media itself and from others. I said, I want us to put out some stats on the good things that are happening. It's not to negate that. That's a reality. Yes, the reality is that for every 10 who are placed into housing, 13 are falling into homelessness right now, right? That's the reality. But there's part of the reality is that there's a lot of good that's happening, right? And if not because of that good, not just on the part of Father Joe's Villages, but across the board, then the situation will be worse. So we came up with what we call a Compassion in Action report that we make public every single month as well. And it talks about, the number of unhoused who are placed, the numbers who are helped through the behavioral health clinic and the like. I mean, because otherwise people lose heart, to your point, right? And that doesn't help across the board.
Tying that into addiction, we know very well that the negative consequences of substance use disorders and addiction can motivate you very much in the moment. But the things we know from behavioral, from psychology and positive psychology in particular, is that the things that sustain recovery are the things you gain long term, right? So the benefits to your relationships, the benefits to building community, the benefits overall to your well-being when you don't engage in some sort of behavior is really what sustains it long term. And so I think it makes sense I love the framework of thinking about using this as a way to make us all part of a better community. But I think what you're doing of the compassion and action and putting out there all of the gains is what helps people stay committed to doing it and to maintain those choices and behaviors that everybody's benefiting from.
Because otherwise what will happen is if people feel that we're just going down a hole, then who wants to contribute? Who wants to volunteer? It's to your point, right? I mean, you have to feel as if, no, this is making a difference. Things are happening, right? And so it's, I mean, you can always wallow in things, right? But there's so much stuff that is happening, and the miracles, I call them miracles. That's the focus, that's what keeps us going at Father Joe's Villages, right? So tell us a little bit about the actual different types of therapies that you utilize, that we utilize ourselves actually at within our behavioral health clinic. We have a mighty team of 5 at this point, and we're expanding that. We're going to at least double it next year. That's because the need is absolutely there. And they go, there's group therapy and the individual therapy and medication that's utilized as well, Suboxone and the like. But you being the doctor, you being the psychiatrist, so why don't you speak to us about that?
There's a lot of different therapies that we can think about, and there's different therapies like you mentioned. So there's different individual therapies and group therapy approaches that we can use, things like cognitive behavioral therapy, adaptations of acceptance and commitment therapy, adaptations of dialectical behavioral therapy. There's all these like fancy terms. There's a lot of things that have an evidence base for being helpful, but the challenge is implementing them and actually letting people have access to all there's mountains and mountains of scientific journals that show the benefit of all of these things, but it doesn't mean anything if you can't implement it in a setting where people have access to it and can use those kinds of things. And so I think that's what's really great. I'm also so impressed with how quickly these changes are happening, particularly with the detox, and how once somebody realizes this is a good idea and sets their mind to it, you can implement it. And so we have all these therapy approaches, and then we want to think about the settings and where and how can people access them. And so I think the detox facility is hugely needed in our community. It's an important gap that's really being addressed. I often, though, will say that detox itself isn't really treatment. Detox is kind of getting you into a place where you're safe enough physically, medically, to participate in treatment.
And receptive enough.
And receptive. If you're in severe withdrawal and you can't even stop vomiting, you're not going to be able to talk to somebody about what you think about substances or even have a conversation about medications that you might want to think about taking. And so that's an important entry point to safely stabilize somebody to participate in treatment. But then what's amazing about Father Joe's is, like you said, we have all these options and different things. And so from there, it's paired with this sober living facility, and that people have different accesses. And so now we sometimes call those recovery residences, right? So that you have this safe place without easy access to substances. And that in and of itself is a therapeutic environment. And so that's part of the treatment. Then we can think about these group therapies and individual therapies. You can think about different intensities of programs. So sometimes I use the analogy of an antibiotic. If you have a raging infection and you take an antibiotic once a month, you're not going to make very much progress on your infection, right? So if you have a really severe substance use problem and you see a doctor even once a month, which is hard to even get once a month in some clinical settings, but even that, it's hard to really make much progress on something that's causing you problems, 16 hours a day, every day of the week, or more. And so we have these different levels where people can access these treatments at different intensities that are appropriate for them. I mentioned some of the different therapies that we can do that can be in kind of individual settings or group-based settings, and groups are really powerful because the peers, the people who are in the group, are part of the therapeutic intervention. And it can be a much more powerful thing when, your buddy who's sitting here with you says something to you that really hits home in a way that somebody else may not be able to. And so group-based therapies are really powerful. And then we have a lot of medications that have come a long way recently, particularly for alcohol use disorder, particularly for opioid use disorder, and even to some extent now with methamphetamine use disorder, where I'm involved in a trial right now where we're testing a medication combination for methamphetamine use disorder that's really shown some good promise. So medication-wise, we're starting to have things in areas that we never really did before.
Dr. Marienfeld, you have all of these interesting treatment options. What are the barriers that our neighbors in need are facing?
I think that there's a number of different barriers. So we talk a lot about access to care. What does that mean? Well, it can mean obvious things like, it's hard to pay for, or insurance doesn't cover the things that you want it to cover. It can also mean not accessing care because there aren't enough providers, there aren't enough doctors of the right area or field, or therapists, or other professionals who help in these areas. It can mean accessing care like transportation. I don't have a way to get there, or it's very, very far away from where I am. So there's a number of different things when we talk about access to care. There's other barriers around not knowing that there's care out there. We talked a little bit about not being able to see well into the future and be hopeful. A lot of times there's this misunderstanding that we don't have effective treatments for addiction and substance use and mental health disorders, when in fact we do have very good treatments that are similar. And when you look specifically at substance use disorders, our treatments are very similar to outcomes for other things. So if you look at outcomes for high blood pressure or diabetes, these are also diseases that have kind of flare-ups, and they get better and they get worse. Sometimes lifestyle changes make a huge difference in the disease progression. Sometimes medications make a huge difference in the disease progression. Sometimes they just get better and worse on their own. And so when you look at substance use disorders and mental health disorders, it's like that as well. There's this waxing and waning. There's a role for changing the situations and the so-called lifestyle factors in your life. There's a role for medications. So all of those are things to think about, to know that there's treatment out there, because I think sometimes that's a huge barrier that people think, or that there's treatment out there for you, for your particular problems. We haven't mentioned the term stigma, but stigma plays a big role in people wanting to acknowledge if they are struggling with their own mental health issues, or if they are struggling with a substance use disorder. There's very clear studies that people who come to healthcare settings with either a mental health or a substance use disorder get treated worse often, and their outcomes often aren't as good because of that. And so it disincentivizes somebody from wanting to share that they may need help in those areas, because they're worried it might affect how they get treated and how they might access care in other areas. So there's a number of barriers. I think also, some of the treatments that we have are not a great fit for everybody. Some of the medications, for example, have side effects that are hard to manage, or some of the medications may make people feel what they might describe as like numb or removed, and they don't like that sensation either. They don't necessarily want to be struggling in the way they have been struggling, but the alternative may not be great. And so some of the treatments aren't perfect, and that can be a barrier in and of itself. But we also want to make sure that people know that there are a wide variety of treatments. And so I think a lot of the barriers can be addressed through understanding, education, and really tackling that access to good quality care. But the huge barrier before we were talking about with Detox, 2 beds. I mean, nobody had access to that hardly. So I think that's a big.
I would add to what you were saying before about barriers. Deacon, you know very well, some of the folks that we serve, our neighbors in need, they are often, preoccupied trying to find where their next meal is going to come from. They are unable to leave their items for long enough or leave their pet for long enough to go seek care. So that's a real barrier seen in our population as well.
Well, it is. It's an excellent point, Maggie. A third of those who are on the streets won't access care in a traditional way, the way we would, right? Brick and mortar. And so they just won't. And so their health situations just become worse and worse and worse. So in 2019, we started deploying a street health team. And you fast forward to today, that Street Health team is now 5 days a week, mornings and afternoons. In fact, we have 3 teams that go out to various locations in order to, again, meet people where they are and start. The most important thing we start doing is building relationship, because that's what it's all about. And we're now deploying psychiatric clinicians as well. So they're going out there into the community, right, for all the reasons we've been discussing, and in building those relationships, so that in time we can get people, draw them in for better services, that they get, whether it's shelter and meals and the like. And so that's an important element, right? Again, and it's not in a judgmental way. It's more so if you have issues with substance use, well, we have medication-assisted treatment, right? Soon we'll have the inpatient detox center, right? So what do you need now? Let's start helping you in your particular situations, and then get you better and better help, right? What do you think, Councilmember, out there, as for when you think about those on the street and you think about behavioral health, and I know you and I have spoken about how this has impacted us personally in our own lives with our own families, right? And it's heartbreaking. And there's so many people out there in the public who have been touched by this some way or another. I mean, I think it's rare to find someone who hasn't been touched by it somehow, right? And so what are you hearing from your constituents? What are your thoughts on what else do we need out there from a policy point of view?
You know, I oftentimes go back to the economics of what creates homelessness. I will always say that the best solution to homelessness is a good job with healthcare benefits, and in particular, if it's a union job, with good healthcare as well. I think that the problem of mental health, the problem of addiction, the problem of any number of disorders that we're seeing in the unsheltered population, we're seeing it in the housed population too. And so we can create these resources for everyone and make sure we have enough set aside for folks who are unsheltered, because they are the most likely to die from these problems. And always remember that they're at the greatest risk. I think that a lot of families are dealing with it in the way that my family dealt with it. And 10 years ago, my brother Alex died from an opioid overdose. 14 years ago, broke his leg in a freak accident, was prescribed oxycodone, and wasn't managed correctly, gets rolled off the prescription, and he turns elsewhere. And that is the heartbreaking story of hundreds of thousands of people. And little did we understand it at the moment. Now it's not so much oxycodone and pills like that. Now it's more fentanyl is laced in all sorts of things. And so what am I hearing? I'm hearing people cry out and say, how are we gonna, 1, stop these poisons from being in our community? 2, how is government going to provide options for my family that is not giving someone a home, but it's a detox bed? You know, that's the thing too. I say to my constituents, I'm like, we know, each of us knows 75 people who might need detox right now. Okay. And if they don't have the bed there for them when they come beg for it, you know, what do we hear from a lot of people? They say, oh, people don't want help. They're satisfied with their life. I'm seeing a lot more people who are far from satisfied, begging for help, but it's like, we got so many people to help, we can only help so many. So that's why I love partnering with Father Joe's. That's why I love working with the City of San Diego staff, with my staff. Got to give a shout out to Carrie Shaw on my staff, who's worked with so many of you to get things done. But that's what I'm hearing out, is a cry for help. And I say to myself, you know, if a person had a reliable job with healthcare, they could have turned to their own doctor instead of relying on the city to figure out something with Father Joe's Villages. If we can create the environment for good jobs, I think that we're going to see a natural decrease in the suffering that we have. And that's going to allow people to pay for their rent, pay for their medications, store up hope. I think that the city government, we can do small legislative changes that have big land use implications like they do for the detox center. But man, do we need to make sure that the local economy is running well. That's what makes the students at UCSD who say, hey, I came here for 4 years, but it's too expensive to stay here, I'm going somewhere else, or I can't, or I got to rent an apartment with 4 people. The economics of the environmental economics really do make that major impact, so that then the few that do have significant genetic, hormonal, physiological issues that doctors can care for, they can focus on those people instead of people who, on the whole, wouldn't go into that situation but for the lack of economic success they can achieve.
First of all, thank you for sharing about your brother. Those types of testimonies are how we humanize this issue and grow compassion. So thank you so much.
Of course.
What kinds of policies or initiatives are you advocating for directly to increase access to these services?
Well, right now we are seeing a full-fledged push from the state to have municipalities, cities and counties address them. I'd say from the city point of view, we are always doing everything we can to be a pro-housing city so that we can get access to state grants and other cities don't get them, so that we can have rent-restricted affordable housing, so that we can have permanent supportive housing, so that the Housing Commission, which is an arm of the City of San Diego, deliver on that and have that funding. Again, it comes back to funding and economics. And now we're looking at the state saying, the governor has been very clear that he is going to reward cities that deal with homelessness in a particular way and cut back funding from places that don't. And that I think that there's a place for the state government saying we're going to reward folks that are trying to deal with this in any number of ways. I think there's been a lot of complacency at levels of government that say, that's that city's problem. And I'll say, the city of San Diego makes that point a lot. We have 18 municipalities in the county of San Diego.